Hi everyone, welcome to my channel. My name's Kate. I'm a trichologist, which means that it's my job to help you with your hair and scalp problems. And in today's video, I'm going to be talking a little bit more about what trichologists do. So if you're wondering what sort of conditions we help with, whether you should see a trichologist or a dermatologist, or you're just a little bit curious about what trichology is, then keep watching. So firstly, what does the word trichology mean? Well, trich comes from the Greek word trichos, meaning hair, and ology is the study of. So trichology is the study of the structure, function, and diseases of human hair. Now, more broadly, clinical trichology is the diagnosis and treatment of disorders and diseases of the hair and scalp. So what are trichologists? Well, trichologists are healthcare professionals who specialise in hair and scalp health, as well as the science and structure of all hair types. Qualified trichologists are able to diagnose and treat hair and scalp disorders, as well as give general advice on hair care, lifestyle and nutrition as it relates to the hair and scalp. Now, the reason that I say qualified trichologists is that currently in the UK, and I think elsewhere in the world too, the term trichologist isn't protected in law, so anybody can call themselves a trichologist at the moment. So what this means is that it's really important, if you are going to see a trichologist, that you check the qualifications and who the trichologist has trained with. The easiest way to do this in the UK is to check on the Institute of Trichologists website. The Institute of Trichologists was founded in 1902. It's the oldest trichology training provider in the world, and most qualified trichologists in the UK train with them. So the types of conditions that qualified trichologists deal with are pattern hair loss, diffuse hair loss, scarring hair loss, problems of the scalp such as itching, scaling, redness, infection, bacterial and fungal problems of the scalp, as well as general hair care practices, hair texture problems, hair breakage, and psychological concerns. So what's the difference between a trichologist and a dermatologist, and who should you see? So trichologists who've trained with the Institute are medically trained, but we're not medically qualified, we're not doctors, unless the trichologist has done separate medical training. Dermatologists are medically qualified doctors. They've done their medical degree and they've gone on to specialise as a dermatologist. So dermatologists are specialists in the skin on the entire body, as well as the hair and nails. Dermatologists are able to prescribe medications as well as perform medical procedures such as steroid injections. Trichologists deal with all types of hair and scalp problems, from scarring hair loss to general hair care advice, whereas dermatologists mainly deal with hair and scalp problems that require medical treatment, and not all hair and scalp problems need medical treatment. So for example, something like male pattern hair loss might not need medical treatment. Trichologists and dermatologists do often work together, and there is some overlap between what we can treat. So for example, with scalp conditions such as dermatitis, which can be treated with a medicated shampoo, both trichologists and dermatologists can advise and treat those conditions, but it does depend on the severity. The other difference is that trichologists work holistically, which means that we look at lots of different factors that can affect the hair and scalp. So I'll go into more about what happens at a trichologist consultation in a moment, but essentially our appointment times are much longer, typically around an hour, compared to the 10 or 15 minutes appointment times of a dermatologist. The advice that you receive from a trichologist also reflects this holistic approach. Also, you don't need a referral to come and see a trichologist, you can book in with us directly, whereas with a dermatologist, if you are looking to see a dermatologist on the NHS, you will need a referral, and there are often weeks-long waiting times to see a dermatologist. Whereas with a trichologist, you can normally get in to see us a little bit faster. So if you're not sure whether you should see a dermatologist or a trichologist, my best advice is to either speak to your GP or contact a trichologist and we can help you. Okay, so next, are trichologists hairdressers? No, we're not. While both trichology and hairdressing deals with the hair, we are completely different. Obviously, hairdressers will cut, colour and style the hair, and they might offer some advice on maintaining your colour or style. Trichologists, as I've said, are healthcare professionals who diagnose and treat hair and scalp problems. Now, this is not to diss hairdressers in any way. Hairdressers play such an important role in maintaining the health of the hair by cutting it regularly, as well as helping us to feel as good as we can about the look of our hair. Now, knowledge of hairdressing practices is really important in trichology because what we do to our hair day to day can cause a lot of damage, and as I mentioned, it's very important in how we feel about our hair. So often trichologists will come from a hairdressing background. So when we study trichology, we study about the science of hairdressing practices as well as different ingredients in cosmetic products. So we know how they affect the hair. And sometimes trichologists do also still work as hairdressers, but their hairdressing business and their trichology practice are completely separate. When you go to a trichology appointment, you won't be walking into a salon. So what happens during a trichology consultation? Well, as I've mentioned, trichology consultations are typically around an hour long because we have a lot to get through. When you see a trichologist, you will of course be in a private room, much like when you go and see your GP, because hair loss and scalp problems are very personal and can be very distressing. So your comfort and privacy are incredibly important. During the consultation, we'll ask you lots of questions from when did the problem first start? What sort of hairdressing practices do you do? What's your lifestyle like? What's your diet like? Family history, genetics, general health, blood test results, and more. We'll then examine your hair and scalp, both just visually and also often with a specialist microscope called a trichoscope. Using the trichoscope, we can see your scalp at high magnification, which means that we can have a look for signs of scarring, changes to the follicles, infections, hair density, hair diameter, and more. At the end of your consultation, you'll be talked through what the diagnosis is, if any, and you'll also be given advice on how you can best manage the problem and whether you need an onward referral to, for example, your GP or a dermatologist. So should you see a trichologist? Well, if any of the following questions sound familiar, then you might want to see a trichologist. So, is your hair thinning? Have you noticed that your hair is shedding more than usual? Have you noticed areas of hair loss? Is your parting getting wider? Is your hairline receding? Do you have problems with your hair texture? Is your hair breaking really easily? Do you have a noticeable breakage and split ends? Do you have persistent dandruff or scaling on your scalp? Is your scalp sore, itchy or painful? Have you noticed inflamed spots or bumps on your scalp? Are there areas on your scalp that seem to be a different texture or colour than the rest of your skin? Is your scalp very oily and greasy? So these are questions that might help identify whether or not you need to see a trichologist. Obviously, these don't cover all of the different questions that somebody might have. So if you have any questions or concerns about your hair and scalp, if you think that there might be a problem or you just want some general advice, then please speak to a trichologist and we can help. So thank you for watching. I hope you found this video useful. If you have any questions for me about hair and scalp problems, please leave them in the comments or follow my Instagram. I'll be making more videos here soon, so also make sure to subscribe so you know when I upload my next video. Thanks so much for watching. Bye!